Good afternoon. Thank you for joining us here at Contacts for Healthcare for today's webinar presentation titled Why Relying on the ICD-10 Code Families in Grace Period Won't Be Enough on October 1st. We're happy you could join us for this webinar, which will provide a basis for understanding the recent announcements made by the American Medical Association, the AMA, and CMS surrounding the ICD-10 family of codes and related grace periods. This discussion will be led today by Contacts Medical Director, Dr. Margaret Klasa. Meanwhile, my name is Kate Armbruster, and I am the Market Strategy and Implementation Manager here at Contacts, and I'll be serving as today's moderator. Here's an agenda for today as we go through this 30-minute webinar. First, we'll walk you through the introductions, talk about the problem, the AMA CMS announcement, the family of codes and grace periods. We've got a couple of case studies to walk you through, as well as some examples of how our ICD-Transformer solution helps to alleviate the issues caused by this family of code situation. And we'll provide you with more information and a chance for questions and answers at the end. So just a few housekeeping items of note. All attendees will remain in listen mode throughout the webinar. We do encourage you to send us questions throughout the webinar. You may use the chat feature in your GoToWebinar screen. And we'll take as many questions as we can during the Q&A session, and we'll provide follow-up after the webinar with any additional questions. Also, each attendee joining us for the webinar today will receive a copy of the slide deck as well as any individual follow-up. As I mentioned, I'm the moderator, so when you get a copy of the slide deck later, you can look a little bit at my background here. But again, I'm the Market Strategy and Implementation Manager here at Contacts. And for some of you listening are brand new to Contacts for Healthcare. Others I know have been long-term customers of ours. So just a little bit about Contacts. We're headquartered here in the Chicago area. We've been leading the field for more than 25 years in healthcare software and data product development. And we've been offering a variety of coding and claim editing solutions. So I do know we have a couple of long-term CodeLink software users that have joined us today. And exciting times to see how ICDTransformer, one of our newest solutions, can add to that range of coding and editing solutions. We've got wealth of knowledge and expertise on staff. You'll hear much more from our medical director, Dr. Margaret Klasa, and her coding staff and medical content team have decades of combined experience. So they are the ones behind the scenes evaluating all the policies, all the current issues, and keeping the knowledge base for our products in the field up to speed. We have great client satisfaction from our client success team, resulting over 97% client retention rate. And again, we've become just an expert in the field in the compliance solution area. Here's a little bit more about our featured speaker and medical director, Dr. Margaret Klasa. So at this time, I'd like to turn the presentation over to her.
Thank you, Kate. And hello, everyone. Here's an example of a code family. And this example is basically from one of our data products, and it lists actually the category of code. And what the AMA and CMF have decided is that basically a code family is the same thing as a code category. So from this example, we're looking at pressure ulcer of the ankle, and it's actually of the unspecified site. So if you look at the code on the left, the far left side, you'll see a series of codes within that family. If you look at the second column, what you'll see next to that code is an asterisk, and that indicates that this is not a valid code, and that this code actually requires an additional character, which in this case the family becomes valid when the sixth character is used. So claims with any of these valid codes will not be denied as long as they are from the appropriate family. They also will not be audited based on specificity, which means that your RACs, the RACs and MACs cannot deny your claim and are required to follow this policy. And the grace period applies to Medicare only, and the commercial payers are not included in this exemption. So basically, what does a family of code and the grace period actually mean for you? Per CMS, the family of code is the same as the ICD-10 3-character category. And as you could see, 3 characters in some instances can be invalid, in some instances might be valid. Codes within a category are clinically related, and they provide differences in capturing specific information on the type of condition. So for instance, if you have a category age 25, which is an age-related cataract, that contains a number of specified codes that capture information on the type of cataract as well as the information on the eye involved. Some examples might include an age 25.031, which is an anterior subcapsular polar age-related cataract of the right eye. And this one has 6 characters. You might have an age 25.22, an age-related cataract, Morganian type of the left eye, which has 5 characters. Or you can have an age 25.9, unspecified age-related cataract, which has only 4 characters. So one must report a valid code and not a category number, and in many instances the codes will require more than 3 characters in order to be valid. So for this first year that ICD-10 is in place, Medicare claims will not be denied solely based on the specificity of the diagnosis codes as long as they are from the appropriate family of ICD-10 codes. Medicare also will not deny payment for these unintentional errors as practices become accustomed to ICD-10 coding. Medicare claims will also not be audited based on the specificity of the diagnosis codes as long as they are from the appropriate family. So this transition period will give physicians and their practice teams time to get up to speed on more of the complicated code sets. Both the Medicare administrative contractors and the recovery audit contractors will be required to follow this policy. Similar to claims denial, CMS will not subject physicians to penalties for the physician quality reporting system or the value-based payment modifier or meaningful use based on specificity of the diagnosis codes, again, as long as they use a code from the correct family of code or category of code. In addition, penalties will not be applied if CMS experiences difficulties calculating quality scores for these programs as a result of ICD-10 implementation. So if these Medicare contractors are unable to process your claims as a result of problems with ICD-10, CMS will authorize an advanced payment to physicians. And CMS has said it will establish a communication center in Maryland to monitor issues and resolve them quickly as possible. And this will include an ICD-10 ombudsman, Dr. Williams Rogers, devoted to triaging these physician issues. So when is a grace period not a grace period? Well, in certain circumstances, a claim may be denied because the ICD-10 code is not consistent with an applicable policy, such as your local coverage determinations or your national coverage determinations. So this reflects the fact that current automated claims processing edits are not being modified as a result of the guidance. Coverage policies that currently require a specific diagnosis code under ICD-9 will continue to require a specific ICD code under ICD-10. It is important to note that these policies will require no greater specificity in 10 than what was required in 9, with the exception of laterality, which does not exist in ICD-9. So your LCDs and your NCDs that contain ICD-10 codes for right side, left side, or bilateral do not allow for an unspecified site. The False Claims Act has not been suspended, and the use of an incorrect ICD-10 code that leads to an overpayment can cause a problem for your provider. A provider can become liable under the False Claims Act for failure to refund an overpayment that's been identified. the False Claims Act can exert penalties and fines for not promptly refunding the overpayment. And it is the power for treble damages. That means the treble damages are a multiple of and not in addition to the actual damages, meaning 3 times the damages. None of this grace period ruling pertains to commercial insurers, however, at this point. It's good to check in with them. They are still going to require the use of accurate, specific ICD-10 codes in order to pay that claim. Their policies and network contracts will obligate providers to meet this requirement. The insurers have a vested interest in the accuracy that's driven by regulations, and their annual risk adjustment process for Medicare Advantage plans and state exchange plans are driven by the diagnosis codes, and the insurers want the risk to be accurately calculated by the government. So how can we help? What can we do? Well, basically, let's take a look to see what our ICD-10 transformer can do for you. In this next slide, we have an example of a right ACL tear. A patient comes in and the nurse actually writes down the ICD-9 code that she thinks, as of September 30th, is causing a problem for this patient because he's coming in for PT. So here, this code, 844.2, and the nurse knows it's on the right side. And basically, this is from the injury, sprain, strain of the knee and leg category from the ICD-10. And on this next example, what we have is basically the ICD-Transformer on the 10 will give you the response of an S83.501A sprain of an unspecified cruciate ligament of the right knee, initial encounter, and an S83.511A sprain of the anterior cruciate ligament of the right knee, initial encounter. If you had a common vendor solution or someone who is just using the GEM files, the GEM will give you one code, and that's your S83.509A, a sprain of an unspecified cruciate ligament of an unspecified knee, initial encounter. If we take a look at another case example, we have here a fracture of the femur, neck, and this neck is a closed fracture. This is an 820.8, and this is unspecified part of the neck, femur closed. With the ICD-10 transformer, we get S72.002A, fracture of unspecified part of the neck of the left femur, initial encounter for the closed fracture. If we look to see how does this compare with a vendor, on the next slide, what we'll see is that the common vendor solution that's using just a GEM file will get an S72.009A, fracture of an unspecified part of the neck of an unspecified femur, initial encounter for closed fracture. So just by using a modifier, our solution can help you determine what is the correct code to use for that scenario. In this next example, which is really pretty impactful, rheumatoid arthritis, in ICD-9 terminology is 714.0, and we have right now an example of using a CPT code, the 23474. And what this actually means is that basically you're going to have a revision of the total shoulder and arthroplasty, including an allograft when performed. It's the humeral and glenoid compartment. With our ICD-10 transformer, we can give you 8 responses, as you can see here. In this next slide, what we can show you is basically when you use a GEM file from a common vendor solution, you will be obtaining 190 responses. Now, many times in an EMR or EHR vendor solution, people have a time restraint. They're not going to go through 190 different replies from a vendor in order to get to the solution. We give you 8, and the 8 that we give you are pretty specific to that shoulder. So the question that needs to be answered is, how will you choose the correct family from these 190 codes when you could be looking at shoulder and hip codes within this 190? So on this next slide, what we can show you and what we can demonstrate here is what a user interface would look like if you were interested in this solution. You type in your response. This is a simple response. We have an ICD-9 code, which is your rheumatoid arthritis, which is your second box, your 714.0. And you might type in your keyword right shoulder. And when we ask for the transformation, you'll see that you get just the 8 codes down below. And from these 8 codes, you can tell that each one of these has the rheumatoid myopathy involved with the rheumatoid arthritis, and it's all of the right shoulder. In this example, you won't be getting right hip, right knee, or left hip, left knee. You'll get exactly that body part that you're interested in focusing on, along with what procedure you're working on with that modifier and laterality. In this next example, what we have here is the rheumatoid arthritis again, and now we've used a plus version within our GUI for the transformer. And what's impactful about this slide is that there are some providers as well as some coders that would like to see basically an expanded version of the 8 responses that you got from the rheumatoid arthritis. And with that, we wanted to have include information, excludes information 1, excludes information 2, as well as the notes section. So with all of this, we're actually increasing our capacity to provide more and more information, not only to the coder, but also to a provider as they're trying to get as much information as possible, as well as maybe even clinical documentation specialists who are looking at charts and trying to aggregate the information that they're getting from the charting. So basically, on this next slide, who can actually use this transformer solution? Basically, our coders, our doctors, our billers can use their current familiar ICD-9 codes. They can eliminate some of the office disruption, maintain productivity, because it's basically been documented that some of that productivity is going to fall off as people start using this new code and as they might be having some denials. This transformer has unique proprietary knowledge base. The body part indexes are instrumental in providing the correct codes as well as laterality and CPT codes. And the results are that almost 57% will give you a single appropriate ICD-10 code, and the remainder will give you a very small set, as you saw, from 190 to 8 appropriate codes for what you're looking for that condition, for that patient. And with that, I'll turn it back to you, Kate.
Thank you, Marge. What a great overview. With our next slide here, we're looking at the ways in which the ICD-Transformer can be implemented. So it can easily be deployed in 2 ways. First, you can provide the user interface to those required to select the ICD-10 codes. And so this is done quickly and easily through logging into the ICD-Transformer website. So that's great if you want to have a lookup that's kind of outside of your main system, but you can go there, look up the codes, and come back to your practice management EHR system that you're working in. That user interface lookup will display those types of results that we saw earlier in the cases with both the simple and the plus options. So just simple, returning the codes, plus returning the exclude, include notes, and so forth. ICD-Transformer is also deployed using our web services. So it can be a SaaS-based web services interface, and it's easily integrated to your system. So if you do have an IT department that to handle your integration and you have more volume requirements, we're able to meet those needs. You basically can go through a workflow that allows you to set the encounter in your system, choose some of the codes, send it via web services API call over to ICD-Transformer, get the code results, and those are populated back into your system. Again, that web service interface really allows for a high volume utilization and allows you to get the information directly from ICD-Transformer. It's highly scalable to handle significant volume, and both options provide an easy and accessible way for any user to get the codes and get the service greatly needed, especially as October 1st approaches. As I mentioned before, I'm with implementation manager here at Context, so our team would work with you to help you determine what would be best fitting for your needs and help you go through a seamless implementation and integration. Here is our contact info on this slide. So again, we'll be providing a copy of the presentation slides to those who attended the webinar. Encourage you to follow this link to get some additional information on our website, or contact us by phone or email to set up a one-on-one consultation as well. And at this point, I'd like to bring us to the question and answer session of the webinar. I have been receiving some questions throughout the session here, so I'll just go through these, and looks like most of them I'll send over to Marge. So, okay. Marge, the first question I have that came in, going back to a little earlier in the presentation, mentioned that right now commercial healthcare or health insurance payers are not following the family code or following the grace period guidelines that CMS set forth. Could you expand on that a little bit for our attendees, please?
Certainly, Kate. Thank you. Right at this moment, the commercial payers have not shared any information for us to research on that basically say that yes, they will follow that grace period and allow for the unspecified codes. However, there is some rumbling in the industry that they feel that there may be a few that will want to do that, but they're waiting till the very end to make that decision. But again, as I mentioned, some of the commercial payers are concerned about the risk adjustment, and that's something that's already been built into their plan. So it's something at this point that I think they have to be concerned about in terms of their reimbursement. But at this point, there has been no information that we're able to follow that says that they are going to allow for a grace period.
Okay, great. Thanks. Yeah, it's even more important to keep in mind that those grace periods and family codes or code families are not going to be enough come October 1st. Got another question. So recently there have been a lot of studies conducted. I know we reviewed one study that was conducted by the Texas Medical Association that indicated that I think it was almost 90% of providers surveyed said they weren't ready for ICD-10. Did you have any additional tips for getting ready, or any additional ways?
Absolutely, absolutely, Kate. Buy ICD-10 because they're going to need it. If they're still entrenched in ICD-9, ICD-10 is very much different. And we can at least get you to the point where you will have your selection for ICD-10 as you develop your top 30, your top 40 ICD codes that you use in your practice. And I think that's the way to go. Normally what we do in our practices is to make sure that our face sheets, our billing sheets, all have information on it that we use consistently, because we have that, and then we have other. And so for that purpose, it's important for the billers, the coders, the providers to really get a handle on the terminology, a handle on the descriptions of the codes, the new codes, the laterality of the new codes. And with Transformer, they can certainly do that very, very quickly, because you're using your ICD-9 and you're getting the correct 10.
Okay, great, thank you. Another question, and I can address this. Got a question saying that we have a current CodeLink Pro customer as an attendee, and wanted to know, is ICDTransformer available in CodeLink Pro? And currently they function separately, so you have your CodeLink Pro software, but have the ability to go through the website through that user interface to look up the ICD-10 codes and encounter information that way, as we saw earlier in the cases. But they work hand in hand and side by side. We've got customers easily using both. And again, there's some flexible integration options. Do you have anything else to add to that, Marge?
No, I think that's a good point, Kate. I think you're spot on.
Okay, good. And I guess we just have time for one more question here. And I know that this has come up in some other webinars, just for Marge, do you think that ICD-10 will really go live on October 1st?
Well, anything can happen, but I think all systems are go for October 1st. We have less than 2 weeks to make it, absolutely. It's going. The grace period will be going. The confusion will start, especially with LCDs. You have to have the exact code. You can't use just the family of code. You have to have an exact code for LCDs and NCDs. Context for Healthcare can provide that for you as well. We have databases, we have information, we have links, we have products, we have applications to help you with your NCDs and your LCDs. If you're stuck with that, we also have the coding families if you need that, and then we have our ICD-10 transformer as well.
Okay, great. Yep. It's hard to believe they'll be here this quickly, coming soon. So looking forward to ICD-10. Well, that's our time for today. Thank you, everyone, for joining us for this webinar. We look forward to your feedback, hearing from you, and happy to answer all of your questions regarding ICD-10. Thank you.
Thank you.